Hello, and welcome to Let's Talk, a Tulsa World virtual town hall meeting. I'm Wayne Green, editorial pages editor of the Tulsa World. Today's town hall is graciously underwritten by the George Kaiser Family Foundation, the University of Tulsa, Oxley College of Health Sciences, and TTCU Federal Credit Union. Today we're joined to be talking about the impact of the COVID-19 infection and its impact on the state by Governor Kevin Stitt and Dr. Kayse Shrum, who, among other things, is a physician, president of Tulsa's OSU Center for Health Sciences, State Secretary of Science and Innovation, and a member of the state's COVID-19 response task force. Welcome to both of you. I'd like to start by offering each of you an opportunity just to make a bit of an opening statement, anything that you'd like to say to the people of Oklahoma today, beginning with you, Governor Stitt.
Sure. Well, thanks so much for having me, Wayne. Really appreciate that, being able to talk to Oklahomans, especially a lot of Tulsans where I'm from. But my main message is we're going to get through this. These next 3 weeks are going to be critical. We have made the right decisions at the right times to continue the social distancing. We're in the mitigation phase. We're watching modeling. Hopefully we get into some of that discussion today. But it's really important that we continue with the social distancing. And I know it's hard on everybody, but we are going to get through this. And these next 3-4 weeks are going to be really critical. But the modeling shows that we've got to really bear down here to so we can get back to some sort of normalcy after this month.
Dr. Shrum?
Yes, as Wayne said, I'm Kayse Shrum. I serve as the president at the Oklahoma State University Center for Health Sciences, as well as have the honor of serving as the state's Secretary of Science and Innovation. I am a pediatrician by training, and I went into the medical profession because I wanted to use the gifts and talents that I've been given to help people in the critical time of need, as well as ensuring that people could lead healthy and fulfilled lives. So after our first positive case of COVID, the governor reached out and asked me to be a part of his task force that he was putting together, not only because of my medical background, but because of my experience at the university. And as the secretary, I've had the ability to work across agencies within multiple healthcare systems, both in the metro area and rural Oklahoma. And I can say as a lifelong Oklahoman that I am very proud when I show up every day and see Oklahomans working so hard to ensure that our frontline healthcare workers have the equipment that they need to be able to take care of Oklahomans and be safe, as well as ensuring that we're all coming together as one Oklahoma to have an infrastructure in place that in a time of need and in this pandemic, Oklahomans will have a place to seek health care. I know it's an uncertain time, it's certainly unprecedented, but together we will get through this.
Governor Stitt, we've gotten an overwhelming number of questions, and far more than from our readers, far more than we could ask today. And a lot of them reflect, frankly, fear and some anger. A lot of them feel like maybe you haven't done enough to protect the state. They want mandatory shelter-in-place orders throughout the state and strict enforcement. Can you explain to us what you've done both Wednesday and yesterday and help us understand why you didn't do it any sooner?
Well, we had our first hospitalization case March 9th when we had our first case in the hospital. We immediately signed an executive order to stop social gatherings. I don't know the exact date, but it was really very short after March 9th. We've also declared a health emergency throughout the state. That is an ability now for us to unify the statewide response as we're gathering the data to build any kind of surge hospitals or field hospitals to meet the demand that we're seeing in our models. We've also, early on, we issued a safer at home order for all the vulnerable population. I just extended that through all 77 counties. through April 30th to match up with what the CDC was recommending. We required all non-essential businesses to suspend in-person services, to close down. And we did that through all 77 counties as well. We're encouraging our restaurants to continue to offer curbside and delivery services. I continued to prohibit social gatherings of 10 or more people across all 77 counties as well. At the end of the day, at this point, I hear a lot of the rumblings like, why aren't you calling it shelter in place? Why aren't you calling it shelter in place? And you're coming down to semantics, really. When you read the shelter in place from some other governors, California for one, New York for another, can you get out to go to the pharmacy or the grocery store? Yes. Can you get out to exercise? Yes. Can you go to work if you're an essential business? Yes. In practicality, it's exactly the same orders that we have. This, at the end of the day, comes down to personal responsibility. And I believe Oklahomans have done a fantastic job. You're seeing businesses innovate. We are working from home. Every single school, we suspended the schools for 2 weeks after spring break. So you are seeing Oklahomans take this very seriously. And again, I know it's difficult because we see what's happening in New York or we see what's happening in other states, and you want to react. But we are having briefings every single day at the National Guard base. We're planning for the modeling. I've got a lot of folks on this issue, and we're doing everything we can to keep Oklahomans safe, and we're making the right decisions at the right time.
Yeah, a lot of readers are raising concerns that there are too many companies that are considered essential, are getting the same anecdote repeatedly about packed parking lots at home improvement stores and that sort of thing, with things that obviously the people asking questions just don't think are really essential. Is there any consideration to narrowing what the essential list includes?
You know, we're following the federal guidelines on the essential. And when you really sit down and you start brainstorming, you start thinking about essential, we would all agree that hospitals have to stay open. We'd all agree that grocery stores and pharmacies have to stay open. And then when you start thinking about that supply chain, it really shows you how intertwined that is. So we know that truckers the infrastructure has to be open to deliver groceries. So then if you have them open, the gas stations have to continue to be open. So it goes on and on and on. So we're trying to follow the federal guidelines, but even the businesses that are considered essential, it is still the personal responsibility. And that's why in my last press conference, I said, listen, let's make sure that we don't, it's not a social gathering when we go to these essential businesses that are remaining open. Let's just do one at a time. And I know that Costco and some of the other big box stores have started limiting the amount of people that can come into the stores. But right now, Wayne, we are in a mitigation phase. This isn't a containment anymore. This is mitigation. We may be in this mitigation phase for the next 30, 60, 90, 120 days. It is not possible to bunker in place. We can't get all of our food delivered. And so we're being practical with the steps we're taking. And I think Oklahomans are doing a really, really good job. But I get it. Some people want to think about, well, let's just bunker in place. It's just not practical. It's not reasonable. And we're not doing anything different in our state than we're seeing in other states.
Sure. Now, Dr. Shrum, there's a lot of anxiety reflected in the readers' questions about medical issues, about availability of testing, about protective equipment for medical professionals, about the supply of ICU beds. Can you update us on those situations? And is there anything that ordinary Tulsans can do to help with the situation?
Yes, well, that's a great question. And all of those items are things that, we're really focused on here on the task force. So I'll start with testing. So as Oklahoma saw its first positive case behind many other states, we experienced what was a slow in the supply chain in our ability to test because other states were seeing more cases. The national supply of test reagents that would allow us to run tests was being sent to other states, and so we weren't receiving those as quickly as we'd like. So we did get behind in our testing in the beginning. But quickly with our task force, that was the number one priority, because we know testing is so important. It's foundational, not only for isolating cases and slowing the spread, but for protecting our healthcare workers. Because when we have cases that are in the hospital that we can't test, they're having to utilize that very valuable protective equipment until they get a negative case back. And so under the governor's direction, that was a top priority. And so we brought in a group of people to begin working on that. I know that you've probably heard about the relaxing of the CLIA waivers and the ability from the feds to allow research universities to become testing sites if they had the capability. And so the governor called on our research universities to begin joining in that effort. And so very quickly, we identified a resource at Oklahoma State University that had served as a testing facility, a laboratory since 1975. It actually serves as a lab that was for surveillance for pandemics in animals. But we're very fortunate. The machines that are in that facility are very high-tech, cutting-edge genomic machines, and they run 90,000 tests through that facility every year. And so a joint between OSU Medicine and that lab allowed us to bring those specialists from the medical school into that lab so we could start really ramping up testing. OU is working on developing reagents to get their testing capabilities up. And we're really working the commercial side to get those reagents here to the state. And we were just very fortunate that my deputy secretary, Elizabeth Pollard, her background is in reagent labs and had a lot of connections with companies that allowed us to really get an understanding of what was going on within the commercial side of the reagents. And so we've really been able to ramp up our testing, and that is so important. So now we're at a point where we were reserving our testing only for hospitalized patients, for healthcare workers, and the vulnerable population, as well as those individuals in long-term care facilities. Now we're expanding that to symptomatic patients and testing sites across the state that are through the state health department. So if you are going to get a test done at one of those locations, you do not need a doctor's order to do that. You can go to the drive-by testing sites that are with the state or contact your county health department to get those done. We want to get as many tests done as we possibly can. The strategic stockpile of protective equipment, which is so important for our frontline workers, and we're focused on that every day. We want to make sure they're safe. They're key to us being able to take care of Oklahomans. We have received 100% of our strategic national stockpile supply, as well as we are taking the same strategy that we did with testing reagents and going after commercial products as well. And so ordering here in the United States as well as in China, and working those channels every day. We have a team lead that's working purchasing and partnering with the state health department and keeping in contact. So for our healthcare workers, we have now a website that's set up where if a hospital who has a COVID positive patient, if they're entering their data into our system, at 3 days, if they drop to a 3-day supply of PPE, it will alert us red, and we will get them back up to 3 days. And so we're making a lot of progress on that, especially with the N95 and the expansion of the ability to get KN95 masks. And so we have put in multiple millions of dollars of orders on masks, because that is, again, so important. The other piece you asked me about was ICU beds. The state has over 900 ICU beds. We are currently we've asked the hospitals to tell us what they can do to go up 40% in their ICU beds. And in addition, we're looking at what the Army Corps of Engineers can do to expand that capacity, as well as looking at hospitals that have closed across the state and how we might utilize those if we need that capacity. So we're working really hard in those areas, and they're very key areas to making sure that we can take care of Oklahomans during the pandemic. The most important thing I think that I would ask an everyday Tulsan or Oklahoman what they can do to help, and that would be stay home. Follow the social distancing, because if you want to help the healthcare workers and we want to slow this down so we can get control over it, our ability to do that is reliant on Tulsans and Oklahomans following that social distancing that we've put in place. If you have PPE, if it's small amounts, you might reach out to your primary care office or your physician's office or provider and donate those. I know in Tulsa, there is a physician who is running a campaign called Collect to Protect. And so you can find that and donate there. The state has, for larger amounts, the state has a website where you can donate your PPE. But I would say most importantly, follow that social distancing. That's what you can do to help us.
And I might add, don't hoard food, don't hoard supplies, because someone coming out of the hospital after working an 18-hour shift probably needs to buy food and toilet paper as much as anybody else, right?
Absolutely.
Governor Stitt, yesterday you declared a statewide health emergency, a fairly obscure piece of law there. I think a lot of people were surprised at how powerful that statute was. It brings the legislature into session, but it gives you some very broad emergency powers to take money from state agencies and move it around. You could even take money from subdivisions, local governments. You can reassign state workers. I know just a minute ago I was telling you, why aren't you doing more? But from the opposite direction, what's the break on you under those emergency powers?
Well, you're exactly right. It's fairly broad, and we're not sure if there's ever been a governor that's declared it in the state of Oklahoma. We don't think so, but it was written exactly for issues like this, when we need a statewide response to a pandemic, and we need everybody on the same page. And so we certainly don't need certain counties doing one thing and certain counties trying to focus on doing something else, building up their supply maybe for a hospital. And we needed a statewide response. You can imagine how complicated it is on moving patients and all that if we really start out surging our capacity. So that was the first thing we were looking at, is we wanted to get the National Guard and we wanted to get the Corps of Engineers working on a statewide plan to strategically plan on where we would put those surge hospitals to cover all 4 million Oklahomans. But the other thing is we needed some broad powers to waive some licensing requirements, getting some of the retired physicians, the nurses back into the workforce, because if you can imagine, if we're surging up and we're doubling the capacity, we have to staff those hospitals as well. So that becomes problematic, and things that our team is working through right now. The other thing is our first responders were begging for the ability to know, well, who is affected when they go into an emergency situation on a call. And there was no way for us to waive HIPAA to allow them to keep our first responders protected and potentially their families as well. So those are the main three reasons that we executed on that healthcare crisis.
But in terms of some of these other powers that are in the statute that you haven't made any sort of specific reference to, the rewriting the state budget on the fly, reassigning state employees. I think everyone would understand if you had to do those in sort of specific surgical instances. But is this going to be an opportunity for a huge centralization of state government power?
Not as far as we're concerned. This is specific around the COVID response and the issues that we're seeing to respond quickly to them. Oklahoma wants us to respond quickly, solve the problem, make sure that we don't outstrip our capacity in our hospitals. I was on the phone with the speaker and the pro tem today. We had a budget meeting. We'll have another budget meeting tomorrow. On Monday, we're preparing for a Board of Equalization meeting. So we're going to go through the regular budget process with the House, the Senate. We're not rewriting anything there. When it comes to our unemployment, this is something that could potentially be used to put more resources on. Our unemployment spike nationally and certainly here in Oklahoma has increased tenfold. And so we're getting 20,000 calls a day into that department. Well, we're not staffed for that. So I've had to move employees from certain state agencies over there to meet the demand to get those resources back out to Oklahoma. But we'll be very transparent. It's really just to solve this issue that we're faced with, nothing more.
The unemployment issue that you bring up was voiced by several of our readers. I'll tell you that they have rent due, they have car payments due, they don't have money in the bank, and they can't get through to unemployment. It's just the system's not designed to handle that many people at the same time. Since you brought up the budget issue, let's skip ahead to that. We were at the same time that we have the hit from the COVID-19 virus here in Oklahoma. We have the oil prices, the bottom falling out of the oil market, which our state budget is still very much reliant on. At the same time, there's a lot of money coming to the state. I've heard more than $1 billion and a quarter of dollars, $1.25 billion coming to the state from federal relief bills. There's a lot of moving parts to this. Are we going to have a revenue failure this year, do you fear, Governor? And are we going to be able to make a budget? Are we going to have enough information to make a budget for next year?
Sure. Well, what's the session that we're in right now? We're looking at 2020's end of the year through June 30th. We're also planning for 2021 fiscal year, and we have 2022 that we're going to be back in here in 9 months working on as well. So really, we're looking at 3 years budget right now. On Monday, our Board of Equalization will meet, and we will declare a revenue failure for this fiscal year that we're in through June 30th. Because just like you said, the oil and gas prices are a huge contributor to that, but also with us moving our tax payments back from April 15th, matching that up for a 90-day period, a reprieve, is going to also push revenue into the 2021 year. So yes, we will have a budget failure this year. This was why it was so important that last year we were fiscally responsible and we saved $200 million in the budget when we were in a good year. So that was huge. We're going to plug the gap this year. I've already worked with the House, the Senate. We're going to be releasing a press statement today that says because of our savings, we're going to fill that gap this year. But in the 2020 budget, I'm going to ask the legislature, we don't have the money to fill 2021, 2022 in our budget. So we'll probably ask some of the agencies to take a 1%, 2%, maybe even a 3% cut when we're looking at 21 and the 22 fiscal year.
In terms of the revenue failure, can you tell us anything about what sort of cuts agencies could be facing in the current?
That's what I'm going to say. During this crisis, it's not my intent to cut any state agency. So we're going to grab some savings and plug that hole for the last. So they shouldn't have any cuts this year. And I forgot to mention the federal stimulus package that was passed. We've been working with our federal delegation to make sure we tell them what we need in Oklahoma. There'll be a significant amount of money coming to the state for relief. However, it's specifically designed for COVID-related expenses, not revenue failures. So it won't plug the gap for oil and gas, but I am having all state agencies, they've already started classifying on expense codes anything that's related to COVID. Those will be reimbursable. My hospital surge will be reimbursable. All the expenses that we have in the National Guard, for example, will be reimbursable. So basically, the president has said, listen, you go fix this, governor, states, you fix the problem and you let us know. And if it's COVID related, we're going to back you up on that. But it won't be something that we can just throw in and replenish our savings account. That's something that Oklahomans need to know. And so we may have to tighten our belt a little bit on some of these agencies until we get our oil and gas revenue and we kind of come out of this. And it's still a little bit too early to tell what that's going to look like for later on this year and also next year.
Dr. Shrum, we've had a lot of detailed questions concerning things that people just don't know how does this work. There's people want to know how the virus is contracted. Can you get it from food or from a package or from a newspaper? Do we need to be worried about our groundwater? How long can this live on my countertop? And one real basic question a reader asked is, how's a COVID test work? What happens? Can you fill in some of the blanks here?
Yeah. So first of all, what we do know is that the virus is transmitted through respiratory droplets. So when someone coughs or sneezes, those droplets go into the air. They go onto the surface and can, live between a few hours to several days on hard surfaces. We get that either by having those droplets be in direct contact to our nose and mouth, or by getting them on our hands and touching our eyes, our nose, and our mouth, because the virus lives on those surfaces and can get into our body through those areas and begin to replicate, and that's what makes us sick. So we either breathe them in or we put them on with our hands. And so we've heard a lot about, don't touch your hands and face, wash your hands for 20 seconds, sing happy birthday or whatever your favorite song is while you're washing your hands, because that kills the virus. And so once it's, dead, we're not moving it around on our hands. So it is that's the way it's transmitted. That's how we get it. So if we're going to test for it, and there has been a lot of confusion around what is actually the test. Do we do it at a lab? So when we're testing for the virus, we're taking a swab and we put it up in the nose, and we get secretions and the virus on that swab, and we send that to the lab. And the lab is actually looking for genetic material from that virus in that sample. And so that's when it comes back positive or negative.
But Dr. Can I interrupt you for just a minute? We're about to lose the governor. I want to get one more question into him, and then
certainly.
So Governor, can you give us some hint of how much longer this nightmare is going to last, and what sort of metric are you going to use to decide that we can take our foot off the brake a little bit?
Yeah. So, the modeling is kind of all over the board right now. It's really early. We have some modeling showing a 4,600 hospital peak at the end of April. We have some modeling showing this goes out into June. There's some early modeling that has it going out to August. And so the best way to describe it, we've all seen like these hurricane models. When it's way far offshore, it shows it might hit in North Carolina and it might hit in Florida. It's really wide. Can you hear me okay, Wayne?
Yes, I can. I'm sorry I went off the screen there.
Oh, that's all right. So it's really wide. So that cone of uncertainty will start to narrow as we get more testing. So that's why testing is such a key that Dr. Shrum talked about earlier. And that's why we've really focused on loosening the guidelines. Let's everybody go test if you have symptoms or if you have been in contact with someone with COVID. So that's important. When will we know? So we're planning for an early peak in April. And as we're watching numbers every day, this is something that's really good news. Our hospital counts have actually gone down for the last 3 days. I'm watching that very closely. So as we see towards the end of April, that's why we have dates on this through April 30th. I'm hoping we can get back to normal. The second thing is we are really close to start testing antibody tests. So that's where you go out and you do a random selection and sampling in the community. And when you do that random selecting, you're going to see if the community has already been exposed to it, if they already have the antibodies. In other words, they've already been had the virus. They just may or may not have known about it, or they have natural immunity to it. And so once you start getting that herd immunity, that's when we know it's safe to go back to work. So there's some people that are predicting that we already have 20, 25, 30% of the folks in the community that have already had it. Again, this is a mitigation process at this point. So we're going to do testing to determine that. Once we get more data and we let Oklahomans know it's safe to go back to work and we can start opening back up, we're going to have to continue with some social distancing for a while, even when we start slowly getting life back to normal. But once we have the data that shows how many in the community have already been exposed to it and have built up antibodies, that's when we're going to give you the green light that it's time to get back to normal.
Governor, thank you for your time today. I know you've got another call you have to go to. I want to get back. I hope we can hold on to you for just a few more minutes, Dr. Shrum. I want you to be able to finish your question, and I also want to ask you about the models that the governor was responding to, was referring to.
Absolutely. So I was kind of going through the process of testing and saying that we do the testing, we take the sample from the nose and we send it to a lab, and the lab is checking for the genetic material of the virus in your nasal secretions. And so that's how we know from a what we call PCR test, that a genomics test, that you actually have the virus. As the governor just mentioned, antibody testing, that's where we can take a little blood and we introduce a part of the virus to see if your body has the antibodies to it. And if it's positive, that means that you have been exposed at some point to the virus. So that is a new ability for us to test Oklahomans and know where we're at. Another part of that question was our groundwater. I've been made aware that there have been stories and information in social media and on the internet that our groundwater isn't safe, and that you can that is a source to transmit COVID-19. That is not true. I would encourage all of your readers, when they read something like that, to just fact check with CDC. They have, or the World Health Organization, or even EPA. Your drinking water is safe. You cannot get COVID-19 from your drinking water. Or I saw that it was being reported that it was in the lake, in catfish, I believe, and that is not a true story. So that is not true. So I want to assure Oklahomans your water source is safe.
Thank you for clarifying. I'm sorry, I didn't mean to interrupt you.
No, that's fine. I think that was, I believe I covered everything that you asked me, unless there's something you'd like me to.
Well, the governor made reference to models. We've seen a lot of statistical models in recent days, local, state, national, and sometimes they seem to be offering contradictory projections. Can you help us understand why?
Yes. So models are really a way for us to take data and project the future. And in order for our projections, it's a lot like the governor said. It's like weather predictions. There are certain factors. There's data that we know and we can plug into a model, and then there are also things that we don't control, which we would kind of refer to as variables, that we can put into the model, but we don't know how that might impact because they're not under our control. When I talked early about we got out of we started seeing cases slow, and so we had or behind other states and certainly behind other countries, and so there was a shortage of reagents and the testing was delayed. The data that we talk about is actually those tests. And so the more data you have, the more reliable your predictions are. And so we also know that in the beginning, people were reporting positive tests, but we also were not reporting negative tests. So the governor did an executive order so that everyone had to report their negative tests too, because that's more data that needs to go into that model for us to understand. The other thing I think that makes it somewhat difficult to really wrap our mind around, and I tell you, I've looked at all the modeling the governor has, and you're right. It's kind of all over the place, and I think that's because of our data being small and variables being plugged in different ways and people predicting. The other thing is a variable, when you look at modeling, you can look at, if people do really well with social distancing, your cases are going to drop. So you put that in there. If people don't do so well, or if there's no interventions, then you're going to see your numbers really high. And so you can see how all these things are fluctuating. And that's why we're really wanting to get the testing, as the governor said. We're really trying to get more testing. We're trying to really capture not only the negatives, or not only the positives, but the negatives, because that's more numbers, that's more data that we need in order for our epidemiologists to really focus in on Oklahoma's numbers and give us that really good projection that we can look into the future.
You're being really generous with your time. And if I can ask for your forbearance for one more question.
Certainly.
The several people who sent us questions are pointing to statistics that they're seeing about a high number of people who are test positive for COVID-19, but who are asymptomatic. Can you explain what that means, and what does that imply about how we should behave?
Absolutely. I think this is one of the very key points and reasons for social distancing. So when you hear that people can be positive for COVID-19 and asymptomatic, that means you have no symptoms. And you can be walking around and spreading the virus and not know that you have it. And so that's why we've really talked about social distancing, staying 6 feet apart, because as I talked about, coughing and sneezing is the way that we can transmit the virus. Washing our hands, not gathering in places more than 10 people, and staying home and staying only with family, but trying to even keep your social distancing with family as much as possible. Because, for one person, it may mean that you're walking around just fine. And for somebody who is immunocompromised, or meaning their immune system just doesn't work as well as mine or, someone else, or for people who have heart disease or, lung disease, that could be fatal for them. And so I think, for me personally, it makes it easier for me to practice social distancing when I think about that, because, thinking that I didn't follow rules, it could cause someone to lose their life. When the governor talks about personal responsibility, that's what he's saying is, we have a personal responsibility, even when we're healthy and we feel great, to protect our loved ones, our neighbors, and just knowing that, we would never want to do anything intentionally that would cause someone extreme harm or death. And in these cases, we just don't know who is carrying it. And so until we can really build up that herd immunity, as the governor talked about, where there's enough people who are immune to it that we're protecting everyone, or we come up with a vaccine. Vaccines are very important, that we can protect the population. We need to think about that seriously and come together as a community and really make sure that we're acting responsibly so that we're protecting those people who are in the high-risk category, and then those who aren't, but could be severely affected by the virus.
So, Governor Stitt, Dr. Shrum, I want to thank both of you for your participation today, and thanks to our viewers too for watching our program, which was graciously underwritten by George Kaiser Family Foundation, the University of Tulsa Oxley College of Health Sciences, and TTCU Federal Credit Union. Join us next week when our third virtual town hall will feature Mike Brose of Mental Health Oklahoma and Dr. Sarah Coffey, Director of Child and Adolescent Psychiatry and Behavioral Sciences at Dr. Shrum's OSU Health Sciences Center. They'll be talking about the psychiatric strain of being isolated, handling family situations under emotional stress, working from home, and dealing with fear. I'm Wayne Green, Editorial Pages Editor of the Tulsa World. Goodbye for now.